Hi, I'm David, and today I'll be talking about the nurse's role in colorectal cancer. So, how can nurses help with raising awareness? To increase the screening rate, you need to understand the barriers and the enablers. People who proactively sought screening showed higher knowledge of colorectal cancer in susceptibility and severity, while barriers such as low perception of risk and fear of diagnosis stop people from getting screening. By addressing these barriers and concerns, nursing interventions can promote early detection and improve help-seeking behaviors by educating patients on symptoms, screening methods, and reducing stigma. Educational interventions about the process and access, as well as guiding the patient and breaking down each barrier a patient faces, showed increase in early detection of colorectal cancer. Conducting risk assessments is also part of a nurse's role. They first need to understand and know the risk factors for colorectal cancer. These are men above the age of 45, obese, smokers, and they consume a large amount of red or processed meats. Nurses must identify those who are high risk and those who are low risk and refer them to the most appropriate screening program. Those who are low risk, for example, those who don't have a current diagnosis of colorectal cancer, or they are asymptomatic, should be referred to non-invasive screenings such as the IFOBT, while those who are higher risk should be referred to the more invasive screenings such as colonoscopies. Conducting risk assessments for colorectal cancer screening can reduce the healthcare stress on colonoscopies and the healthcare system in general. By individualizing risk assessments, nurses can optimize the use of healthcare resources and providers to reduce the stress on the system. Risk assessments also need to be done for cancer survivors to reduce their individual risk of recurrence and survival outcomes. While caring for the patient and the families, nurses are in a unique situation where they can actually evaluate the family's behaviors and initiate behavioral change interventions, especially towards the caregivers. Nurses can explain the significance of their results, discuss further actions and education, arrange consultations, and advocate for the patient with the National Cancer Screening Register. Effective communication skills such as active listening, promoting socialization, supporting family and caregivers with empathy are used to deal with the challenging times to provide support during diagnosis, prognosis, distressful moments, and treatment, as well as promote adherence to treatment. Nurses help translate medical jargon into layman's terms and aid patient and family understanding and management of disease progress. Education on lifestyle changes such as proper balanced diets, regular sleep, self-care have a positive effect on the caregivers and the patients. Providing education on symptom management has shown to increase their skills related to the care and reduce depression and anxiety levels in caregivers. Nurses play a very important role when collaborating with the multidisciplinary team. The oncology team, including the nurse, helps deal with emotional stress and workload stress. Collaboration with the oncology doctor is crucial when providing medical care as it improves adherence to treatment, reduces the incidences of side effects, reduces fear in the patients and the family, and helps identify patient concerns and weaknesses. Nurses working in the community can advocate for the general practitioners to address barriers and enablers through education of colorectal cancer. Collaboration with community healthcare workers can increase health education and raise awareness for colorectal cancer in racial and ethnic minority populations. Nurses can also work alongside community healthcare workers in follow-up care plans, scheduling appointments, or linking local services about screening that is most suitable for the patient. Here are some recommendations for early detection, engagement from the community, and advocating for the patient. Understanding the barriers and enablers of screening will help improve the screening rate. People who had high health literacy were more proactive in screening, showed higher knowledge of colorectal cancer in terms of susceptibility and severity, while barriers such as low perceptions of risk and fear of diagnosis stopped people from getting screenings. To improve patient perspective, the health belief model should be used to identify perceived barriers and susceptibility to individualize the approach and actions to motivate screening rate in men above 45. Within the multidisciplinary team, GPs have a lot of influence in screening rate. However, at the moment, current research has shown that there's very little engagement from GPs in terms of follow-up care. Although nurses collaborate within the multidisciplinary team with everyone to advocate for the patient, it's sad to say that it's not the same when it comes to medical specialists and GPs. Medical specialists did not consider GPs important in the follow-up care process, while GPs didn't want to participate in follow-up process, citing that they lacked knowledge and preparation and increased workload. Within GP clinics, nurses can be stationed there, such as advanced practice nurses, clinical nurse specialists, and nurse practitioners who can help collaboration between healthcare professionals and expand the scope of practice in treatments and referrals. With the use of survivorship care plans, it has been shown to improve care coordination of symptom management and follow-up recovery. The Cancer Council Australia has identified that community health promotion and education that is curated to the appropriate communities have increased participation in building awareness and participation in screening rates. However, nurses don't have the best reach to raise awareness for that, and more research needs to be done. However, raising awareness in younger age groups for early detection is critical in increasing new participants. Thank you.